Good afternoon. My name is Ushin Walker. Today's date is November 1st and the time is 1:40. I'm here today to perform a Foley catheter on a male patient. Before entering the patient's room, I have all my supplies. So now entering the patient's room, I make sure that the door is closed and I provide privacy with the curtain. So I'll introduce myself. Hi, my name is Ushin Walker. I'm your nursing student today and I'm here to perform a Foley catheter on you. Can you please tell me your name and date of birth? And you verbalize that to me as I check his armband to make sure it's correct. Have you gotten a Foley catheter before? He states no. When was the last time you voided or urinated? He says 2 days ago. Okay. So at this point, I'll adjust the bed and make sure it's at my waist level or normal working level, right? I would then wash my hands as I would before I enter my patient's room. Put my patient in the correct position to do the procedure. Make sure his feet, is a bit covered just in case he gets a bit cold. Right, at this time I would put a bed blanket over my patient just to give them some more comfort. Right. And at this point, I'll get my kit, put it right here where I set up my sterile field. I'll put this bag at the end of my patient's bed. Make sure my patient doesn't move. And make sure my patient is aware that the bag is right here. At this point, I'll carefully start to set up my sterile field. And I would like to point out that before starting anything, you would assess your patient's perineum area to see if it needs cleaning. In this case, it doesn't. I would now go and put on my sterile gloves. This here is clean and dry. Make sure it doesn't flap back. I use my non-dominant hand to start with my dominant hand. I'll just work my hands in it. Sometimes these gloves takes a while to get on your hands. Now that my gloves are on, go back to my sterile area, right? This is what we would put over the patient's perineum area. And this is an absorbent pad. Well, in this case we have two, so we'll just discard one. So this is an absorbent pad, so make sure the shiny area is placed downwards. And all of this is sterile, so even though I have my sterile gloves on, I can touch either sides, but make sure that when I'm putting it down, my hand does not touch underneath and just on top. So I place this under my patient. And I carefully place this over the patient's perineum area. I'll then proceed to start setting up my sterile field. So now that I've extended my sterile field, I can put the rest of my stuff over. So place this right here. Get my cotton swabs. Make sure that they're easy to access. Place that right there. Get my lube. And put this back here or drop it anywhere else. Then at this time, I would test my Foley to make sure that my balloon works. And it is careful to note that you have 10 cc's of fluid in your syringe. So we'll test our Foley. Make sure that the balloon inflates. Right, my balloon works. Okay, so I'm gonna just let gravity pull at that fluid. And it's also careful to note that throughout the procedure, you talk to your patient, make sure that they're comfortable, that they're not in any pain or anything. Waiting for this fluid to pull back. Okay, so now that all our fluid is back into the syringe, we'll go ahead and rest this right here. We could take it off, but because when we start to clean the patient, one of my hand will become non-sterile. So I will just keep this on. Right, so I'll start cleaning my patient. So I'll have this on right here. My first swab, I'm gonna clean inside. My second cotton swab, clean outside. My third cotton swab. Right. Then I'm going to lubricate the tip of my Foley generously. Make sure I communicate with my patient and tell them that I'm about to insert. So have them inhale, and while exhaling, we'll insert. So inhale, 1, 2, 3. Then we'll insert. Once I feel some form of resistance, then I could go ahead and use my non-sterile hand to hold right here as I inflate the balloon with the fluid. Then I carefully take this part off and take some until I feel resistance. Okay. Then at this point, the sterile part of the procedure is over, so I could take my gloves off. Done. You do an hygiene again. Then you could put clean gloves on. For this video purpose, I would then I'll take my bag, put the date and time that the Foley was inserted, record the amount of urine, the color, the odor, if any, and put it at the side of my patient's bed. And in the same instance, if they wanted a specimen to the lab, then I'll take right here pull this part off right here and insert some urine into the specimen cup, which would be this, and send it to the lab. So that's my video of inserting a Foley catheter on a male patient. Hi, my name is Ushin Walker, and I'm here to demonstrate how to take out a Foley catheter from a male patient. So before I enter my patient's room, I basically came with everything that I think I'm going to need, which is my 10 cc syringe, because that's the amount of fluid that we inserted into the balloon, and an absorbent pad just in case there is none under the patient. And also we're going to need clean gloves because this is a clean procedure, not a sterile procedure. So going into my patient's room, I'll create privacy, close my doors, and I'll introduce myself to my patient. Hi, my name is Ushin Walker, and I'm here today as your nursing student, to take out your Foley catheter. I'll make sure I go to my patient and check his armband for his name and date of birth and make sure he verbalizes that to me also. Then at this point, I will go do my hand hygiene, put my clean gloves on, I have my syringe and my absorbent pad. Make sure the shiny part stays down. I'll put the absorbent pad underneath my patient. Right? And some Foley catheters, especially in the hospitals, you see them tape it to the patient's leg, and it shouldn't be taped like straight ahead. It should be with some form of leeway. In this case, the patient didn't have any tape, so we're gonna go ahead and attach this onto the patient's Foley, and then gravity is going to pull the fluid out, and we should get 10 cc's back. So now that we've gotten our 10 cc's back, we're just going to take this off, cover it back, communicate with our patient, letting them know that we're going to take the Foley out. So have them inhale as we carefully pull the Foley out and wrap it in our glove to prevent it from swinging back. We'll put it in our bin, and then after this we'll document that we got 10 cc's back, make sure patient is in good condition, ask them how they tolerated the procedure, make sure they're not in any pain. So that's my video on how to insert a Foley and how to carefully take out a Foley. Thank you.